Know the warning signs of oral cancer. I was a dental hygienist for 18 years, and unfortunately this happened so much in our office, and it's very sad. So it's good to know the warning signs. If your dentist or hygienist isn't doing an oral cancer screening on you when you go in, make sure you tell them that you want one. So things to look out for, or things that might increase your risk, would be smoking, heavy drinking, chewing tobacco. And another thing that people don't realize, if you have an ill-fitting denture, partial, or even a really sharp tooth in your mouth that's constantly getting irritated, those are things that could possibly lead to cancer. So if you have a spot in your mouth, the most common places for you to get cancer are the sides of your tongue and the floor of your mouth. But honestly, you can get cancer anywhere in your mouth. So if you have a spot, even if it doesn't hurt, make sure you consult your dentist. We usually tell a patient if that spot doesn't go away within 2 weeks, that warrants you a visit to the oral surgeon so they could do a biopsy. Two patients that will stick with me forever. I felt so bad for them. One was a guy in his 40s who chewed for quite a few years. He had cancer on the floor of his mouth. They had to remove part of his tongue, floor of his mouth, and actually part of his jaw. It was awful. I felt so bad for him when he came in. They had to reconstruct with, I don't know if it was his arm skin or leg skin, and he had hair growing in his mouth because of the hair on your legs and your arms. So of course he had to get laser to get that removed, but it was just devastating. Another one that will always stick out to me was this lady in her 50s. I thought it was honestly a burn. I asked her if she burned it on soup or pizza. She wasn't sure. It didn't hurt. It just honestly looked like a burn. We told her, if this doesn't go away in 2 weeks, please come back. It didn't go away, and we sent her to the oral surgeon. She had it biopsied, and it came back cancerous. And not only did she have to have that part removed, they had to remove part of her hard palate, and it was awful. She had to have a prosthetic piece on the roof of her mouth because if she ate or drank anything, it would go right up through her mouth and out her nose. I felt so bad. She eventually had to have reconstruction surgery, and the roof of her mouth, she got that closed up. But how devastating. And you see people in their 20s getting cancer, and they don't even smoke or chew, and a lot of people have lost their lives. So please, 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 if you see anything in your mouth, even if it's not bothering you, please go see a dentist.